My name is Leslie Dach, and I'm the chair of Protect Our Care, a healthcare advocacy group in Washington, D.C. We're here today to talk about the threat to Medicaid and the Affordable Care Act because of the relentless efforts by Republicans in Congress and this administration to take away healthcare from people who need it and to make it more expensive so they can fund massive tax cuts for the rich and the biggest corporations in America. They want to take away healthcare from at least 13.7 million Americans and raise insurance premiums for millions more. And so over the next few weeks, Republicans are poised to make the largest historic cuts in Medicaid ever. They also voted against continuing the financial assistance millions of Americans get through tax credits to afford their premiums on the Affordable Care Act. And as big as these numbers are, the real stories are about the individuals in this country, some of whom are with us today, who rely on Medicaid and the Affordable Care Act for their health and the health of their families. 72 million Americans get their health care on Medicaid, and for every one of those people, there's a family who cares about them and worries about them. Nearly 25 million Americans get their insurance through the Affordable Care Act, and every one of them has a family who worries about them. You're here to listen to the stories and concerns of these three everyday Americans. And let me quickly introduce them. Elena is the executive director and co-founder of Little Lobbyists. She's also a mother of a profoundly adorable, now practically nearly adult a daughter who relies on both the Affordable Care Act and Medicaid for her complex medical conditions. Elizabeth Booker is a healthcare advocate, and she too, in earlier parts of her life, relied on Medicaid for her health care. And Alene Shaheed is a Medicaid recipient in the sense that she now can live at home without having to go into a nursing home because of the help she gets from Medicaid. And of course, we're joined by a special guest who's given me the ability for a few minutes to first start with our other guest, the leader of the Democrats in the House, Hakeem Jeffries. And one thing I just want to say, not only is he a brilliant leader of our side, but he also is incredibly passionate. And he has always, through this, centered the stories of real Americans, everyday Americans, and what he thinks about why these issues are important. And so with that, I know what we're going to do is going to hand it over to the leader. He's going to make a few opening remarks. I think he's going to kick off this conversation, and we want it to be a conversation. So thanks, everybody, for being here as part of this.
Well, thank you so much, Leslie. Thank you for your leadership. Thank you for all the work that Protect Our Care has done and continues to do as it relates to the healthcare of the American people. Protect Our Care, of course, was at the forefront of the efforts to save the Affordable Care Act against Republican efforts to repeal and displace people off of it in 2017. And we're so thankful for those organizing efforts, the work that was done, and always centering the stories of the American people, which was critical then and will continue to be critical now as we race to save Medicaid from the largest proposed cut in American history, which will be devastating, for children and women and people with disabilities and older Americans and everyday Americans all across the country, devastating for hospitals and nursing homes and community health centers, and devastating for the healthcare of the American people. And at the same time, work to save the Affordable Care Act from another assault that is being led by right-wing Republicans. This is an issue that I think really lays out a divide between how we all think about things and how some of the extremists on the other side think about things. They apparently believe that access to high quality and affordable health care is a privilege in America. No, this is the wealthiest country in the history of the world. Access to high quality health care should be a right available to everyone. And there is still a lot of work for us to do to get to that place, but we should not be going backward. And that's why this fight is so particularly important for all of us. And, we saw earlier this week that the relevant committees, particularly the Energy and Commerce Committee, had, I think, the longest markup in modern American congressional history as Democrats relentlessly throughout the day, into the night, into the next morning, and then throughout the following day, stood up and showed up, spoke up on behalf of the healthcare of the American people. And we will continue to do that. And we're doing it because we're inspired by all of you. We work for all of you. And we know how critically important it is for us to protect your healthcare. And so as we transition from this week into next week, the next few days will be particularly important in making sure that we're making it clear in congressional district after congressional district that the American people are paying attention, that many of my Republican colleagues have tens of thousands, if not hundreds of thousands of constituents who rely upon Medicaid, which is an important part of the fabric now of how healthcare is delivered in the United States of America. And we expect these Republicans to do the right thing by their constituents. And we only need 4 Republicans to have the courage to stand with us as House Democrats, and we can stop this devastating attack on Medicaid and the Affordable Care Act and the healthcare of the American people. And that's where the experiences of those who have been telling their story and sharing their story is so incredibly important. Thankful for Elena, thankful for Alene, thankful for Elizabeth, of course, who are with us. And perhaps just to open up the conversation, I'll turn to Elena, who has led the effort on behalf of the little lobbyists that has been so powerful in relation to saving the Affordable Care Act, allowing us to then strengthen the Affordable Care Act, and now, of course, back in the fight to protect Medicaid and protect the Affordable Care Act at this moment. And so perhaps I'll just open it up with, this question. As we engage with some of our Republican colleagues over the next few days and into the early part of next week, and several House Democrats will be traveling in to various districts, our own, and districts that may be represented, by people on the other side. What would you have us say to them as part of us? We only need 4, as to why standing on the side of the American people requires us to stand on the side of pushing back against these aggressive cuts to Medicaid and the Affordable Care Act.
Thank you, Leader Jeffries, and thank you, Protect Our Care, for this. I sit here in a dual capacity, both on behalf of families like mine who all have children with complex medical needs, and I'm also a mom to my amazing daughter, Xiomara, who is the joy of my life. And I'm actually sitting in a hospital room right now, receiving care for her to thrive. I was watching the markup, and this is personal, and it's particularly poignant at this time. So I think what I would say is there are real people behind these numbers. There are children with complex medical needs whose only way to live in the community is through Medicaid, through the home and community-based services that Medicaid pays for. And this vote that we saw this week really was a betrayal of the family values that Republicans claim to champion. If they were really in support of family values, they would support children like mine, children with complex medical needs and disabilities, and support Medicaid for helping them live at home and stay in the community.
Thank you.
Why don't we, Alene, I know that you want to share your story with Leader Jeffries, if you could do that, and what would you have him say to a Republican he's riding the elevator with in Congress?
You're asking me what would I say?
Yeah, what would you want a
Okay,
Republican
Oh.
member of Congress to know
Okay.
about this issue?
what I would say, Leslie, is that the Constitution of this United States gave me the right to life, liberty, and the pursuit of happiness. At 80 years old, on $23 per month in food stamps, pursuing happiness is rather difficult. So if there is a cut in my $23 in food stamps per month in my wheelchair at 80, my pursuit of happiness becomes almost non-existent. That's what I would say to them.
Yeah, and what would you tell them about the care you get at home with your wheelchair and your other, what allows you to stay in your own home as opposed to having to go to a
Okay.
facility?
My independence is everything to me. I worked for 30 years. I've always been independent up until 2017. So I am the same person that I was before. And what allows me to remain independent and not in a nursing home is the home health aide. They are my lifeline. Without the home health aide coming in and assisting me on a daily basis, I go into a nursing home. And that's where my dignity, my independence, my self-reliance, it goes, because now I'm in an environment that is restricted, and that has never been me. I lived the life that independent life, and I'm quite capable of living at home.
Well, thank you for sharing that, Ms. Shaheed. And I, I have no doubts that you have an independent spirit. Just having the opportunity to hear from you with the passion and intellect and dignity that you've communicated. And thank you for raising the issue about home health care, because that, of course, is another critically important part of what Medicaid provides. As Elena talked about, caring for children with complex medical needs. How can anyone with any decency not want to do that? But then, as you've communicated, making sure that our beloved and cherished, more seasoned Americans, can make sure that you have the dignity and respect that you deserve during these amazing, years of your life is also critically important and central to what Medicaid is about. So thank you both for sharing.
Elizabeth, you've decided to put a lot of your time in now to being an educator, an activist. You want to tell us why you've chosen healthcare to you, and kind of what you're learning as you try and educate others and engage?
Yeah, I decided to be a public health lawyer when I was 9 years old. I decided that I was going to fight for healthcare when I was 9 years old, because at 2 years old, I was diagnosed with chronic illnesses, disabilities, some unspecified immune issues that kept me in the ER and in the hospital at least monthly for a good chunk of my childhood. All the Halloweens that my sisters would trick or treat for me because I was in the ER, all the movies that I learned word for word, because when you're sick and little and can't breathe, there's not much you can do. And I was on Medicaid. I was on TennCare in the state of Tennessee. And when I was 9, I watched the movie John Q with Denzel Washington, and I learned what health insurance did. And I know that's a very dramatic, melodramatic movie where he's fighting for his son's heart transplant, but it clicked for me at that moment what insurance meant and what it meant to be on Medicaid. And so to the Republicans who are trying to take this away, I would tell them, you are telling me, the supposed pro-life party, that I don't deserve to live. And you have told me that at the age of 2, my life was not worthwhile. And I get very emotional because this is my personal story. And I don't often get emotional on my page, but you're telling me that everything I've done, I'm a scientist, I'm a lawyer, I've been a presidential management fellow, I do the work that I do now in DC, and I come from very humble beginnings in Memphis, the first high school graduate in my family, college graduate, grad school graduate, law graduate. But you're telling me that at 2 years old, I should have just had my life cut away. And that's not right. And no child, no person in America should have the value of their life placed on not having access to something that they should have access to, because healthcare is a right. And I see Elena, I saw you on the steps of the Capitol when you guys were doing your sit-in, and I was looking at you because I've been on both sides as the disabled child and now the mother of a disabled child. And I'm so blessed and lucky to have good private health insurance. But that shouldn't determine whether my son gets access and gets to live and another child does not. There's no sense in that.
Well, Elizabeth, thank you so much, for for sharing in such a passionate, authentic, way about what sort of has driven you into doing this work at this critically important time. And you're absolutely right. It's extraordinary for us that part of this whole tax scam, this scheme, is also connected to trying to provide massive tax cuts for their billionaire donors and people like Elon Musk. It makes it even more extraordinary. In 2017, it was immoral that they were going after the Affordable Care Act. And a lot of that seemed like it was ideological, and it was because it was something that had been put into place by President Barack Obama, and they had this unhealthy obsession with it. And nonetheless, they were going to go after the healthcare of the American people and hurt people. And that was egregious. But this time around, they actually are going after the healthcare of the American people, as part of a scheme to provide massive tax cuts to their billionaire donors. It makes it all the more toxic. And in many ways, as John Lewis would often say, budgets are a moral document. Show us how you spend money or take money away from the American people, and you'll show us your values. And this is a values-based fight right now, as all of you, have powerfully articulated. And we're going to continue to try to lean in to elevating, the stories of the American people, of all of you, as part of this fight, knowing that we just have to get to 4 Republicans, or just have in the House, or 4 Republicans in the Senate, and we can stop this, this toxic scheme from taking shape. And we're committed to pushing that, forward, an enlightened path forward as aggressively as possible. We'll break today in the House, and then we'll reconvene on Monday before the Rules Committee to try to again communicate to the American people on Monday before the Rules Committee why this is all something that needs to be stopped, and they need to hold their elected officials accountable. And then there'll be a possibility that votes could be taken sometime next week on the budget. We don't believe the votes are there, that they currently exist right now. And that's as a result of all of your efforts and the efforts of Protect Our Care and the little lobbyists and the organizations that have been working on this. Republicans believe that they could just steamroll this very early on and jam this down the throats of the American people. But they've not been successful in doing that, which is why their timeline keeps getting pushed back. And so we're going to keep our foot on the gas pedal, and we're inspired by all of you to continue to do that. We know we're on the right side of the American people, the right side of this issue, and the right side of history. We just want to make sure that the right outcome takes place. And we're committed to this fight, to being in this fight until we win this fight.
Thank you, Leader, for all that you do. It's an inspiration for all of us to have champions on our side, like you and your colleagues. And hopefully we won't have to reconvene this meeting to ask you what to do to hold the Republicans in the House accountable. But part of me thinks we're going to probably need chapter 2, at least in some way. So I want to thank everybody who took their time today, takes their time every day to be part of making America a better place for everyday Americans. And let's hope everyone stays healthy.
Thank you all. Onward.
Thank you.